Hello, my name is Luke and I'm a addict. Today I want to talk about why people use drugs and why people continue using drugs, why they just don't quit if they don't want to do it anymore. This is a topic that I think this is where a lot of the misconceptions and misunderstanding happens, because not a lot of people really understand why someone continues using. So I've gathered the most frequent stories of that I have heard from other addicts and other people, as to how they got started, how they mainly got addicted. And I'll start off with family. A lot of people, a lot of younger kids and young adults grew up in houses where their parents were addicted to a drug, and that really opens up a child's eyes. I mean, children are not dumb. They pick up on everything you put down. And not a lot, but a good number of friends and acquaintances I've had over the years say that they grew up with their dad being in a gang or their mom addicted to drugs, and that's what got them addicted. Because with family, I mean, you want to be close to them, and with an addict, you're going to get the closest with them if you're going to be using right alongside them. If you're not using next to an addict, they're going to feel partially blocked from you, because they feel like they can't be completely honest or tell you their true thoughts, because if you're not an addict, if you're not using right along with them, how would you understand? And that's their perspective. Along with that, a lot of younger kids don't see what's wrong with it. I mean, if mommy and daddy are doing it, then why is it wrong? I mean, a lot of that initial influence in a kid's life really sets them up for failure or success, depending on what you do. And unfortunately, if a kid is in a household where there's drugs and it's a addiction problem, odds are they're going to be pulled into that too, because like I said earlier, they don't see what's wrong with it. So they're going to do it because they want to be like mommy or they want to be like daddy. That kind of rolls into my next one, which is experimentation. This is not necessarily right along with family ties and family influence, because it could be there's a great family, mom and dad are hard workers, the siblings are great, but then a kid finds a bottle of pills in the bathroom cabinet and they just want to see what it does, so they try it. I've had a couple friends where this is where they started. Their mom or dad had a prescription of Percocet from a dental surgery or whatever, and they took the Percocet or Vicodin, whatever, for a few days, and then when they stopped taking it, they started getting the withdrawal symptoms. And after a few days of being on Percocet or Vicodin, I mean, everybody's taking Percocet or Vicodin for a week after a dental surgery. So it's not like you're getting horrible withdrawals, but you feel down and out. You feel shitty. You feel like it's pretty much a bad hangover, and it'll last a couple days. So once they do that, they are experimenting with whatever they have. Then if they enjoy it, if they like it, then they're going to go to their friends or go to the streets to try to find a replacement once they run out. So experimentation is definitely another big one, especially with younger kids, with teens. So that's why, I mean, there's campaigns all over saying throw away your old pills. Make sure if you want to keep them that they're in a safe spot where kids can't get to, because that's definitely another big way that kids and teens and young adults end up getting addicted, is because they just want to see what it does, and then before they know it, they're dependent on it, or their body is dependent on it. The next situation, if you want to call it that, or reason why somebody would start using, I think this is the saddest one, is they're trying to numb or escape from something that's in their life. They want to not feel, basically. They want to escape from their feelings. They don't want to deal with it. They don't want to cope. And drugs, alcohol are the best way to do that. I mean, it makes you not care and makes you just think everything is going to be okay. I mean, it's that warm blanket that covers you. And unfortunately, a lot of this has to do with traumatic events, whether it's a traumatic childhood or if you were in a car crash or, anything. Any traumatic event could push you over the edge, especially if it's a traumatic event with injury and you're prescribed these drugs and while you're on them, while you're in the hospital, everything's fine and dandy, but as soon as you get out and you realize you're back in reality and how shitty things are, and if you have trauma, if you have a form of PTSD with whatever happened, it could definitely push you to keep using, because it'll make you feel better. It'll numb out that pain and numb out those feelings. So that's when I'm sure most people have heard of the term numbing, because that's exactly what it is. I mean, it numbs those feelings so you don't feel that pain, and that's another big reason why people start using and keep using. So number 4. Of the reasons why people start and keep using drugs, I'd say is the weekend warrior. Somebody on the weekends goes crazy, and they have that what happens in Vegas stays in Vegas mentality of their weekend. They think that they can do whatever they want on the weekend, go crazy, and then come Monday everything is back to normal, back to what they were like on Friday. I've seen this happen a lot, where especially cigarettes is kind of a weird one, but I'm a victim of that too, where I only smoked cigarettes when I drank, and it was only on a weekend. But then after it progressed, I ended up wanting to smoke when I was stressed out, or when I got off work, or when I got out of school, and so it became more of a crux at that point. But weekend warrior is definitely one that I've come across and I've experienced, not only with myself but other people. For some reason, humans have that mentality where they think they can do something on the weekend just because it's 2 days that you don't work. You think that you can get away with anything. You eventually get hooked on it, and your body becomes dependent, and you need it to function at this point. So you go from being able to party on the weekend and get that feel good, that high feeling, to having to use it during the week just to feel normal. And that's kind of the worst part of it, is when you get to that point, a lot of people go into denial at that point, and then they start using some more to numb that feeling out of denial, and realizing that they are addicted at that point, and then they use more and more and more to try to just block all that out. But weekend warriors, almost all of my friends, I'd say, is a symptom of the weekend warrior complex, at least with some form of drug. And number 5 on my list of reasons why people start using drugs and keep using drugs is the social user, and isn't really the same as peer pressure. I've met people that they like doing drugs when other people are doing drugs with them. I've met people that they say they're social users. They only do drugs with other people. They don't do them by themselves, and they do it because they want to fit in, or they have that typical American complex of they are only happy when other people are happy, which is a symptom of the American culture. But social influence, I just met a couple people who say that they only do drugs when other people are doing drugs around them, and they're only happy when other people are high around them, or when they get other people high with their drugs, which is kind of weird. But I want to wrap kind of that with peer pressure together, because they're kind of one and the same. They are different, but they are kind of one and the same too, because peer pressure, you do it to fit in, which is basically what I've been talking about, but kind of different if you understand what I'm saying. Where peer pressure, somebody is pressuring you to do it, whereas the social user will do it regardless, but they just enjoy to do it with other people. But both of those are factors and reasons why people use. They want to fit in, and unfortunately, that American thought and that American conditioning that we have had impressed on us the past however many decades definitely plays a part. Sorry, it's getting kind of cold out here, so I switched hands. The last number 6 reason why people use drugs or start using drugs, let's say, is the failed healthcare system. I can also attest to this, my personal experience, like with my introduction videos. I explained that I was prescribed morphine and Percocet, and that's what got me originally addicted. The failed healthcare system, doctors just don't understand. I mean, a lot of them do understand. A lot of them are great doctors, but a lot of them don't, because they've never gone through it, and they don't understand what's really at stake here. A lot of the users are prescribed something legitimately for a legitimate pain, but then they end up not getting weaned down correctly in a right time frame, and they end up being addicted. So that is the last reason that I have thought of why people start using. Now, I'm sure that there's plenty of other reasons that you can think of why people start using drugs, but those are the 6 that I have experienced in my life and I have come across with all the addicts that I have met. So there is, in summary, the family influence. If you grow up in a household with drugs, the chances of you becoming an addict is astronomical. You know, it's almost, I mean, I haven't met many people that are not addicts who grew up with addict parents. And that goes along with alcohol too. A lot of alcoholic parents create addict kids. And whether it's alcohol or something else, I mean, it's all drugs, it's all addiction. Number 2 is experimentation. Kids experimenting with things they shouldn't be, just to see what it does, what the effects are, and then they end up getting addicted. Number 3, the numbing, or the trying to escape the situation that you're in, or the feelings that you're facing. It's a coping method to use these drugs, which it's not a healthy one, but it is one, and it's one that people use. Number 4 is the weekend warrior complex. I like to call it a complex. It's really just a mindset, or whatever you want to call it. Like I said with cigarettes, that's how I got addicted to cigarettes, was just smoking on the weekends when I drank, and then it became a stress relief coping method, and it just snowballed from there. Anyways, number 5, the social user, or peer pressure. They're not really the same thing, but they kind of fit into the same category. The social user uses because they like using around people, and peer pressure, somebody gets pressured into using. And then lastly, the failed healthcare system. So those are my 6 that I thought of situations, circumstances, reasons why people start using drugs. Now, I'm sure there may be other reasons or circumstances, situations that you can think of that pushed people or made people start using drugs, or push them over that point. But those are what I have experienced in my life. I thought about this for a few days, and those really cover them all, of why somebody starts using. And once they start using, like I've mentioned so many other times before, once you're addicted, you don't necessarily get your drugs to get high. You get your drugs to feel normal, to be able to operate and function like a normal human being. And that is one thing I really hate about it. You know, you don't feel like a normal human being. And I personally don't feel like a normal human being at any point in whether I'm sick, I'm withdrawing, or I'm high, or I'm somewhere in between, because I always feel like I'm dependent on this substance. I'm dependent on this. I don't have a normal life. I don't have normal relationships. You know, I don't feel like a normal human being, and that tears me apart. Now, once somebody is addicted to one type of drug, they may start experimenting with other types of drugs to get that high. The first time you get high, you'll never get that same high. At least that's how I feel. And I've heard other people mention that phrase as well. You don't feel this. If you smoke weed the first time you get high, it's not going to be the same high the second time you smoke it. You know, it's going to be a completely different experience, because the first time you go into it, you're not knowing what you're going to expect, or you're not expecting anything. You don't know what's going to happen. So there's a lot of room for interpretation. And then that second time, you're expecting what's going to happen. So you know that exciting feeling, that adrenaline isn't as high. So a lot of addicts, once they are on a drug, they will experiment using other drugs to try to get that feeling again, to try to get that initial high, that initial adrenaline rush or excitement that they got with their first use. You may ask, if somebody goes to jail and gets out, why do they relapse? If they don't want to be an addict, if they want to get clean, why do they relapse? And a lot of it, especially if they're not in jail for a long time, once you come out of jail, you're still feeling like crap. It's not like once it's out of your system, you're back to normal. No, I mean, when you get clean, you're kind of your feelings and your emotions and everything is still kind of mixed up and jumbled and kind of trying to rebuild itself. So you don't have the same feelings and emotions as you would if you were getting high or if you were clean for a year. So a lot of people go back to using to get that to feel again, or to maybe start numbing something out again. The high feeling, especially once you're clean, when you're within that first year of being clean, nothing can really match it. I mean, it was short of jumping off a bridge, bungee jumping with that adrenaline rush. There's really not much that can match it. So that's why a lot of people relapse. You feel like there's nothing else out there that is going to make you feel the way that you felt when you're using, and you feel like kind of dead inside because you don't have those big emotions. I mean, when something happens, when your team wins the Super Bowl, you don't get excited, you don't care. I mean, and then you see everybody else around you all excited, jumping up and down, and you're like, what's wrong with me, And then when you get high, then you have those feelings, whether or not they're real or not. I mean, you do have them more so than when you're trying to recover, because your brain is just so garbled, And when you're using, you know what to do, you know how to act, and you know how you're going to act. But when you're clean and you're in that first initial stage, it's hard to get worked up for anything. So that's why a lot of people go back to it. So I hope this helped a little bit to anybody that doesn't really understand why somebody would start using drugs. Those 6 situations that I listed, I think, do cover a lot of the population. Let me know if you are an addict, which one you fit into, or if I didn't list something that applies to you or somebody you know, let me know. I'd love to hear if there's something else out there that people think is a reason why somebody started using. But it's getting really cold out here, so I'm sorry if I'm shivering a little. My hands are kind of freezing. Hopefully I'll get out here earlier in the day when it's a little bit brighter and not as cold. But yeah, I'll talk to you guys here in the next video.